Dear viewers, happy to see you again. This time, let us deal with the autistic child. This is one condition which is universally present now in all the countries. But very unfortunate, you got mixed ideas and mixed wrong ideas about what actually it does. In most of the areas, unwantedly and unwarrantedly, they do not even understand what they are talking about. Whenever they talk about this one, they say mental retardation. No, kindly don't say all those things. In brain of any child, only two types of problems they can come across. I can say three types. One is chromosomal disability, that you forget, that is comes as congenital. Another two types is, in one type, you can see dysfunction of the brain cells. And another way, you get degenerative changes in the brain cells. Dysfunction is entirely different. That alone comes in most of the cases, as in the name of autism in other countries, and minimal brain dysfunction as in states. In here they call it as MBD, minimal brain dysfunction, they say. Sir, how do you differentiate both the things? But people and patients who have got only dysfunction, their anatomical growth will be normal. There will not be any restricted growth. Everything will be normal. They will be as normal as anybody. But the problem is, their cognition will be lost. They will not be having the cognition. If you command something, they don't understand what you say, they don't understand your command, or neither they would like to obey for your command. Nothing they happen. They will be very comfortably seen. Each and every patient will have his own world. He will be very comfortable. Some of the autistic patients, when I come across, they are very good in hearing music. If you play one song, immediately they'll tell what is the song and how is it. Everything they'll be very acutely they'll be say, brilliantly they'll say. I have seen patients who is always drawing. Hard to believe me. Nobody, even the best artist could not draw like that. They'll be very comfortable, but they do not know anything else. Very sad part of it is, even the parents, this child, it doesn't even recognize its parents. No, yes, he is my dad. Yes, he is my mom. Like that, no, absolutely no. How she is with them? Because repeatedly, the patient, the patient, if it keeps on seeing the same face, they will be little bit comfortable with the face they are seeing. So they will be comfortably with their parents. But actually, they do not know, it is my dad, it's my mom. Like they do not know. You cannot force them to do something. If you force them to do something, automatically, vehemently, they will react with the screaming. Because socialization will not be there totally. They do not know what other man thinks if I behave in a different way. No, they do not understand. Because that social, that behavioring, it will be lost. For so many children, because of loss of this education, loss of this teaching, loss of this trainings, they will be, most of the times, they will be dumb, mute and dumb. What is the reason? Because they are not taught. They do not know. Because once I become 3 years old or 2 years old, my mother kept on telling me that Amma, I started telling Amma. If nobody teaches me this one, then how come I can talk? Talking is a practice which you have to develop. You have got a humpty number of languages in the things. Each and everybody, they have to train in their own mother tongue. So unless you are being taught, you will not speak. Even if your speech is normal, that is one part of it. Right, what is the treatment? Why it is like that? The problem is, because the input will not be there, because the brain will not obey to the command, the commanding thing that is afferent and the efferent favor, that is a reaction or the response, you respond to the command, will not be there. That's the problem. So what we do, we first assess the patients on looking at the eyes. We'll keep them. First, how we go about is, we go for needling in 11 places in the scalp. Particularly, it's called as scalp acupuncture. If you do that 40 minutes a day, both in the morning and evening, or for most of the patient, one time, 40 minutes a day, for 90 days, 90 sittings. I can show the first result. In name of God, I can tell you. This is what it is being proved. Then after that, what is that first result, doctor? We do not know. Only the parent will come and tell me, doctor, so far he has not done this one. Now she is doing this one. Because what is this, the socialization? How she greets a new member in the house. Most of the time they will be running off. They will not say hello. And what are their personal habits? What is the type of sleeping? How she answers to the nature calls? What is their food habits? If she is hungry, what she does? Everything. Everything will be taken into account. At the end of the 60 days, we can see the betterment. End of the 90 days, definitely I can show them the first result. They themselves will come and tell me that, doctor, now it is, she was not doing this all the time. Now she is doing it. And happily they will tell me. After that, 15 days in a month. For three times to 6 times. That is the end of a time. Once and for all, you can put them in normal school. But usually what the mistake the parents are doing is, they wanted to prove the community people that their child is normal. They put them in normal school without giving treatment. What will happen? He will start developing his own world, so he will not be accommodating with the other guys. So naturally he will be a headache for the school itself, for the class itself. So number one. Number two, what happens? They will take them to special classes, special schools. What they do? They will give them training to say good morning. But are they doing it wholeheartedly? No. No. Once you see me, you have to do like this. Good morning, good morning, good morning. They will try it that way. Because the uptake is not there. So when the uptake is not there, what an amount of instruction you give to the brain will not respond. I am not underestimating any of the people, special schools. No. But this is the problem. When the particular child could not respond to whatever you say, your command, then how come she could understand whatever you teach her? No, absolutely no. You can habituate them to do this certain things in their own way, but you cannot make it done by their own, by themselves. That is where acupuncture comes in. But believe me, no medicine, nothing. You go for needling for 90 days. At the end of the 90 days, first result you can see. At the end of the 15 days in a month, for 3 months to 6 months, you can put them in normal school. In Nemagood, I can tell you. Sir, actually the problem and the pain and misery is facing the parents, the parents of the child are facing is unexplanatory, sir. At any part of a time, they cannot be happy or merry. The reason being is, somebody in the house, if it's a girl child, I'm very sorry to tell you, when they cross their 12 years, they could not leave her and go somewhere. All time they have to be very cautious. I met one mother, she brought a son of 31 years old, met her daughter, same thing. The moment she came and met me, she started screaming and told me, doctor, you better kill me because I could not bear the hit, that blow the boy is giving to me. Because he doesn't know what he's doing is hindering his mother. That's a problem. He's active at the age of 31. The mother was a very puny lady. She couldn't bear the hit given by him. And each and every suddenly, if he wants, he will start hitting her. Being a son, how many days she could bear all those things? But believe me, after the treatment, thank God now they are normal. So this is possible. So at any point of a time, don't feel sad or don't feel guilt that your son or daughter with an autistic child has a mental retardation. No mental retardation. Don't ever say mental retardation. There is no retardation at all. Everything is normal, but something is dysfunction. This dysfunction, through acupuncture, you can make it normal. So this is how we go about. Thank you.